I am Professor Chris Brightling at the University of Leicester. I'm really pleased to introduce to you the FOSP-COVID Consortium. We have all been touched by COVID-19, whether that's having to stay at home, whether it's affected a loved one, a family member, a colleague. And for many people, it's led to the need to go to hospital with very severe disease. Tragically, many people who've then gone to hospital have needed intensive care support and some have died. FOSP-COVID is focusing on those people who've been to hospital with COVID-19, have survived and have gone home. It's a great success story for those people, but what we don't fully understand is what happens next. It might be that those people have a full recovery, and in fact that incident where they had severe COVID infection is just a memory. In some people, there may be additional problems. It may affect the lungs, as that's the organ where the COVID-19 infection starts. But we've also recognized that in some people, the infection can go beyond the lung in where it affects. It can affect blood vessels. It can affect the brain. In some people, it leads to chronic fatigue, chronic pain, depression, anxiety. It is because of this broad collection of possible problems that we really need to understand what's the scale of that burden of disease post-COVID-19 hospitalisation. So to try and answer that question, FOSP-COVID has brought together a multidisciplinary team of experts. We're going to tackle the problem by assessing people in a standardised way. There will be detailed standardised questions, tests including imaging such as magnetic resonance imaging and CT scanning. And we shall also then embed this research into normal clinical care. So in essence, people will be coming into hospital for their care, but in addition will be invited to have further tests and questions in order to then participate in this research project. FOSP-COVID is across the whole of the UK, including all of the 4 nations. And we're looking to recruit 10,000 individuals that have been hospitalised. Understanding the burden of FOSP-COVID is really important, but it is not enough. That will just give us an indication of the scale of the problem, but won't give us the solution. So FOSP-COVID wants to also then start to understand and implement solutions. Many people who have been in hospital with COVID-19 have participated in intervention trials. The most well-known of those is the recovery study, which has recently shown phenomenal success with reductions in death in people who received the steroid dexamethasone. We will be including people who've participated in the recovery trial and other intervention studies for COVID-19 in hospital. This is really important. It's important because this might be part of the solution. We might find that some of the treatments given in hospital actually alter the trajectory, so alter the outcomes after you've gone home. It's possible, though, that we need further solutions. So we already have within our expert groups a number of really clear ideas of what kind of things we think might happen after COVID-19 infection. And as part of having those ideas of what might happen, we've already got a list of possible interventions that might then change the course of disease and reduce the burden on those patients. What we're going to do in FOSP-COVID is we're constantly going to keep the information that we're receiving under review to then prioritise the different interventions that we can give patients in the forthcoming year and 18 months. Post-COVID is being supported by the government funding, UKRI, and the NHS funder, NIHR. We're also supported by the Clinical Research Network, and many patients will be invited to participate in this study through their local hospitals and through their regional centres. I thank all of my colleagues that have been so amazing over the last few months in helping people with post-COVID, and the many excellent ideas that have come together to make post-COVID a success to date. But the real success will lie in us properly understanding the magnitude of that effect in patients post-hospitalisation, and even more importantly, being able to make a difference to those patients that have suffered from COVID-19 infection.